Upright row is another exercise that is not very effective and not necessarily healthy for our shoulder joints due to the distorted, unnatural movement. As the name suggests, it involves lifting a barbell held with both hands or rarely separate weights or resistant band along the torso in upward direction, and its main goal is to train the middle deltoids and the upper fibers of the trapezius muscle. Here are the reasons why I advise against this exercise. First, it is very uncomfortable for the wrists due to the uneven load placed on these joints while holding the barbell, even with a light load. In addition, the higher the barbell is lifted, the more we put each humerus into internal rotation within the shoulder joints. While the movement of the arm in this position is not a big cause for concern because it's within the physiological range of motion, the addition of load means that the soft tissues located between the shoulder blade and the humerus, such as the supraspinatus, can become compressed and mechanically irritated. This leads to chronic inflammatory problems and can even result in rupture. I have already met many old gym goers complaining of pain in the front part of their shoulders. Do not blame everything on age and aging of the body. Many of these problems are caused by incorrect exercises that significantly deviate from the anatomically optimal movements for joints and muscles. Have you ever wondered, while doing this exercise, why you can use even several times more load than, for example, during lateral dumbbell raises? The actual primary levers of the shoulder muscles are the arm bones. Although the forearm bones are not connected directly with these muscles, they are secondary levers, and their position in relation to the humerus can increase or decrease the load on the muscles. This is because the weight is held in our hands and not above the elbows. If this were the case, the forearms and hands would have no significance in the exercise except for their own weight. For a good understanding of this phenomenon, I recommend another test. Perform the exercise of dumbbell lateral raises with arms straight and then with arms bent at the elbows at a right angle and compare which one is heavier. As you can probably guess, it will be much harder to lift dumbbells with straight arms than with bent ones, provided you don't cheat. Every weight placed in front of the body shifts the resultant center of gravity forward. The greater this shift is, and thus the fourth arm, the more it loads the extensor muscle of the back, called the erector spinae, which prevents the spine and thus the entire trunk from bending forward. You have to answer whether the activation of this muscle is needed in this exercise, which due to the unfavorable position of the forearms in relation to the shoulders, for example, ineffective levers, requires the use of a greater load. The last problem is the neurological phenomenon of bilateral strength deficit that I mentioned in my previous video, which did not appeal to the administrators of the largest fitness Facebook group in my country. In short, it is based on the fact that the muscles that perform movements in opposite directions, such as the lats, side delts, and or obliques, are the strongest when they are engaged individually, not both at the same time. In the case of upright row, this phenomenon limits the strength capacity of shoulder muscles, which could be fully utilized with unilateral training. Therefore, when it is possible, for example, the stability of the body during exercise is not compromised, it is worth performing unilateral exercises or alternate exercises involving both sides of the body. It is also much easier to focus one's attention with such style of training because there is only one and not two opposite directions of movement. To sum up, upright row is another exercise which I strongly discourage all gym adepts who care about joint health and optimal training results. I have done this exercise once in my life, and after the discomfort I felt in my shoulders and elbows, I automatically considered it risky for my health. And I did it right, because technical correctness in relation to this exercise is an oxymoron. This exercise cannot be improved. A person who trains wisely, a person who trains smart, strives to load the muscles as efficiently and maximally as possible using the smallest necessary load precisely by taking biomechanical factors into account in their training. So how to train the middle parts of the shoulder muscles and the upper trapezius muscles in a better way? It is best to train the middle deltoids one at a time through the purest and most anatomically correct movement. For example, using cable side raises with a pulley or by lifting the arm while lying down. The upper fibers of the trapezius muscles are best trained using standing dumbbell raises or using the same movement but instead of dumbbells using low positioned handles of 2 pulleys or free motion machines found in some gyms.